I'm Dr. Dilip Raja, consulting urologist and andrologist, practicing in city of Mumbai for the last 35 years. I'm affiliated with Leelavati Hospital, Saifi Hospital, Hinduja Hospital Khar, and Breach Candy Hospitals. I also have my own clinic at the Bandra on the Waterfield Road. Today, we are going to discuss a few basic aspects of the kidney stone diseases. Kidney stones are very common problems, urological problems in the human body, and this can be from mild to severe in character. So let's discuss, friends, about the kidney stones, how it can harm you and how it can get the relief. So, what are the kidney stones and how are they formed? Kidney stones are nothing but an accumulation or crystallization of some of the solid particles which are natural constituents of the body. These kidney stones could be a small size of a grain size or a chickpea size to a large as big as a golf ball. Kidney stones can be made of variety of types. It is either the calcium, oxalate, uric acid, steroid or cystine stones. What really happens is that these particles which are already into the circulation gets deposited slowly, layer by layer into the kidney, and then subsequently they lead to a formation of aggregation of all these crystals or the small particles and form a small to bigger size of the stone. So how do you know that you have a kidney stones? The kidney stones can be absolutely asymptomatic. They may not give you any trouble and you may not realize that you may have a kidney stone. But when they become notorious or when they start giving you trouble, the most important thing you may get is a pain. And pain is the one which is classically known as from loin to groin. And pain is the criteria which brings you to a urologist. It can be associated with nausea, vomiting, which is also very common. Subsequently, you may also see some blood in the urine. And finally, in case of these kind of things progress, you may get even fever with chills. And once this fever sets in, you know that you have already crossed the dangerous zone and your kidney might be infected. So what are the causes of kidney stones? The kidney stones are primarily either because of a less water intake or increase in eating the substance or consuming the substance which actually goes down to form the stones. So there are certain climatic conditions which leads to the stone formation. For example, dry climates, like in our country, places like Rajasthan where the water quality is hard and people normally, even if they drink more water, they tend to deposit those increased minerals or substances like calcium, oxalate and uric acid into the kidney. And this, in addition of increment of the substances and poor intake of water, leads and associated with these climatic conditions can lead to the stone formation. Further, the stones are found in the people with the sedentary occupations, the people who are mostly living a luxurious life, they are not exposed to sun or they drink less quantity of water, and there are certain metabolic disorders which also are there in the body which can lead to the stone formation. So, how do we diagnose these kidney stones? Obviously, it is very important to take the history of the patients, whereby the patient will complain of a typical loin to groin pain, burning sensation while passing urine or blood in the urine. But this requires to be confirmed by certain imaging techniques. Like most simple test to do is an X-ray KUB. This is a plain X-ray with a good bowel preparation which will tell us about the position of the stone, its opacity, its size, its number. It may not tell us anything about the function of the kidney or anything, but it will show us the presence of a stone. The next thing what we do is a routine urine analysis. This will show either the presence of the pus cells or the crystals or the blood in the urine. Next thing what we do is an ultrasonography of the kidney. Ultrasonography of the kidney further will localize the position of the stone in the kidney. Ureteric stones are generally not diagnosed by ultrasound, but by indirectly they may give rise to the back pressure into the kidney and you can diagnose the presence of an obstruction to the kidney. Subsequently, your urologist would ask you to do either an intravenous urography or a CT scan of the abdomen and pelvis. This will not only localize the stone, It will also tell you about its obstruction present or not. It will also tell you about the function of your kidney, whether your kidney is functioning properly or not. CT scan, in addition, will also give us the density of the stone. And all these tests combined together will give us an idea about the location, nature, type of the stone and localization of the stone along with the functioning of the kidney. If the kidney functions have deteriorated more than what it is seen in this investigation, there would be a few more investigations to be done. So the next question comes up is, how do you treat these kidney stones? So the kidney stones, or whether kidney stones or the ureteric stones or the bladder stones, all these will have its own modality of treatment. So if we are talking about the kidney stones and the ureteric stones, there are various types of treatments are available depending on the location, size of the stone. One of the most common non-invasive technology is called extracorporeal shockwave lithotripsy. This is a non-invasive technique whereby the shock waves or the rays, which are sound waves, are transmitted on a focused stone, and the rays are passed through the body without damaging the other organs of the body. It goes and hits the stone and causes fragmentation of these stones. These fragmentations, subsequently in a powder form or a small size particles, will pass out through the urine. This may take time from 2 weeks to 8 weeks, and depending on the size of the stone and the mass of the stone, this treatment can be selectively performed in a person with the kidney stones. The second technology is called the ureterorhinoscopy. In short, we call it URS. Ureteroscopy is ureterorhinoscope per se is a small fine instrument that will pass through the urinary passage, normal urinary passage, be it in a male or a female. And it goes all the way into the ureter, which is a tube which connects the kidney to the bladder, and the stone could be stuck anywhere within that. So this ureteroscope travels all the way up to the stone, localizes the stones, and then we use either the basket, if it is a small stone, to pick up and bring it out, or we use laser fibers or laser machine to kind of fragment into fine particles, which is either passes out on its own, or it subsequently can be brought out either by the forceps or by the baskets. The third thing, if the stone is gone into the kidney and it's not in the ureter, there's something called a technology called RIRS, that is called retrograde intrarenal surgery. That means the same pathway is used through the urinary passage, and this flexible ureteroscope. Earlier was a rigid ureteroscope, now it's a flexible ureteroscope which goes into the kidney and goes into the various pockets of the kidney and localizes the stone, picks up the stone, or we can blast it into small fine fragments by using the laser technology. And of course, finally, in a very large stone, very rarely, we can also do the open surgery, which is nowadays become practically a rarity, and most of the stones are handled or treated by one of these endoscopic methods. Sometimes, when the stone is very large and is situated into the kidney and fills up many more calyces and cause a stone is formed which is known as a staghorn stone. This stone particularly cannot be treated by either ESWL or by the URS or by the flexible RIRS. In that condition, the technology what we call is the PCNL, that is percutaneous nephrolithotripsy. In this condition, what we do under anesthesia, a small 1 centimeter cut is made at the back and a kind of a track is established directly into the kidney, and by passing a telescope through that, we visualize this stone, and this stone can be broken into so many smaller fragments either by lithoclast or by the laser. These kind of a large stones, this becomes a minimally invasive treatment, and these stones can be delivered from this percutaneous tract and the kidney can be made stone free. In a very large and complicated, there will be more than 1 or 2 punctures may be required to kind of remove all the stones. Percutaneous nephrolithotripsy is far superior than an open kidney surgery for the removal of the stones. Open kidney surgery in today's time is very rare and limited to not more than 1 or 2% of the cases. Hence, the various technologies like ESWL, ureterorhinoscopy, RIRS, PCNL, and at the end of the line is the open surgery. These are various methods by which we can remove the kidney stones and ultimately make the patients free of the kidney stones. If these stones are not treated, they can become very dangerous to life and they can become infectious, and these infections can spread into the kidney. So please do not ignore your kidney stones, and as soon as they are detected or you have the symptoms inside, please come forward for the removal of the kidney stones, and your urologist will decide which of this kind of a technology is used for the making you stone free, and subsequently put you onto the prevention program whereby you do not form the stones again. And as it is rightly said, prevention is better than cure. So please friends, do not ignore your kidney stone disease and come for the treatment as soon as possible without getting into trouble. So once having treated the stone, obviously the obvious question comes up is how do you prevent the stones? Because in urology or in our field it is said that once a stone former, always a stone former. And obviously one wants to prevent as to how the stone is not recurring again. So most important thing remains is even after the stone is treated and one is stone free, he must continue his lifestyle management. Lifestyle management means he has to continue to drink increased amount of water. When you say increased amount of the water, what I mean to say is about 2 to 2.5 liters or maximum 3 liters, and the person must pass as a prevention at least 2 to 2.5 liters of urine in 24 hours. Second prevention, one can do it depending on what kind of a stone it is. Those substances which are rich in formation of the stone, say for example, if it is a calcium and oxalate stone, then one can use the cut down on the increased intake of calcium and oxalate, which is so very much present in milk and milk products. So if somebody is drinking 2-3 glasses of milk a day, he should cut down. I'm not saying you abandon it completely, but you certainly must cut down. Again, increase intake of dry fruits like chana, badam, pista, kaju. These things, they are very rich in oxalate. So along with the milk products which are very rich in calcium, these oxalate, they are consumed together, they go ahead and form calcium oxalate stones. For another example is the fish, which is very rich in uric acid. So if one consumes a lot of fish as a daily diet, then he is likely to form the uric acid stone. Besides, there are certain metabolic disorders, hypercalcemia, hypercalciuria, hyperuricemia. These are the conditions whereby there is an increased formation within the body of calcium oxalate or the uric acid, which goes to lead to the stone formation. Further, there is a gland called parathyroid which can secrete increased amount of calcium and can further lead to. So if one really has to prevent this, one has to prevent the causes which leads to the formation of the stones. And if any of these metabolic disorders are found, even they need to be treated at the same time for a total prevention of the stone disease. In spite of all this, there is no further future guarantee that you will never ever form a stone. As I said earlier, once a stone former, always a stone former, but prevention is always better than the cure, and one must take proper precautions